My name is Melanie Rose Rogers, and I am a founding member of Safe Access Colorado. We are a newly formed chapter of Americans for Safe Access, headquartered in Denver, Colorado. And I just would like to share my story of my involvement with ASA up to this point. So last year, let's wind back. So I have been a cannabis advocate since my first stunt in cannabis advocacy was in 2012. I was asked to play a benefit concert, and I play the violin, and my husband plays the guitar, but we were part of a fundraiser to raise legal funds for the first medical cannabis patient in Denver who got fired from his job because he tested positive for THC. So because I had already been involved with the cannabis community as a patient, I was able to just find my way up to this opportunity to actually use my talents and raise money for an important cause. So that was back in 2012. I started working in the industry in 2015. And at the time I worked for a branding agency that was dedicated to the cannabis space, and I was doing great work. But I really missed the meaningful side of what brought me to cannabis, which is patients, patient advocacy, just the medical side of this industry. I wasn't interested in working with, big tobacco who was knocking on the door and wanted advertising, consulting or branding consulting. I found myself to be more called to do the work for patients and patient advocacy, really keeping true to the medical side. My parents are both doctors and nurses, and I was supposed to be a nurse myself, but found myself working in cannabis at the time. So in 2016 probably was the first time I had heard of Americans for Safe Access. And actually a partner of mine had come to the conference, and I helped raise money to send her to the conference in 2016. But it really wasn't until, I'm boots on the ground in Denver, Colorado, now working with different cannabis patient advocacy groups. I've been at the Capitol, for when Colorado added PTSD as a qualifying condition. And I saw just kind of our, what we were doing at a local level right there for patients and for, patient rights. And then really it was last year, I received a scholarship to come to Unity. And it was a very exciting time for me. I remember applying, being like, I don't know, I'm not even a member, maybe, but I'd been kind of involved, and I was definitely dedicated to advocacy at the time. And actually, I was nominated in 2017 as Advocate of the Year for the Cannabis Business Award. So I was like, let me take this advocacy thing to a whole nother level. Let me find out who's doing it. Let me finally meet Americans for Safe Access. So I applied for the scholarship, thinking, who knows? I was very happy and honored to know that I won the scholarship. So I came out to DC, my first time meeting everyone here at Americans for Safe Access, and I was blown away. I've been in the cannabis industry for quite some time, working in it since 2015, so I've been to lots of conferences, but this one made my heart explode, because this one was really about patients and the medical side of the industry. Colorado was the first state to completely legalize with adult use medical and all of that. And what I had seen was that the patient community was definitely more fragmented. We didn't have a complete, a wonderful umbrella with amazing resources that was definitely established and had a backbone of resources and a powerhouse of people on their board, and people who had been advocating for medical marijuana across the nation and the globe. So for me, I was really blown away. This wasn't a conference about what shiny products you have and how long you've been in business. This was one really that spoke to what I'm about, which is patients, the rights, to keep medical, to definitely prove the efficacy and all the things that ASA stands for. And actually, to bring that back, my background is I used to work for Cigna Healthcare. I used to work for one of the top 5 health insurance carriers. So I love that a part of ASA's mission is to definitely have this covered by insurance. at some point in time. And so I hope to one day be able to bring my experience working in the insurance world to making that a reality. And I want that also for patients. So I came back to ASA, again, back to me being here at Unity about a year ago. And really, I mean, Dr. Ethan Russo was here. I was definitely motivated and inspired. And around the same time in Colorado, we had a Autism Bill. We were trying to add autism as a qualifying condition for medical cannabis. Now, I remember I'd been with these families at the Capitol advocating on this bill, and we were, so after I came back from ASA, I'm sitting at the Capitol, and I'm very inspired. I'm like walking around after doing the lobby day, where I actually got to meet with my District 1 Denver representative, Deanna DeGette, and I actually got 30 minutes with her, and we talked. I got to talk about medical cannabis. There is a fear of losing our medical, side of the industry and having it kind of dwindled away. And I actually brought that up, and I also talked about the CARES Act, and I was really empowered, even more so, to bring this back home. We needed, a stronger medical umbrella and backbone right in Colorado. I'm seeing this firsthand as I'm pushing for the Autism Bill, yet my Rolodex of doctors and medical professionals are very slim. And at one point, the governor then, Hickenlooper, wanted to hear more about doctors. And on the very last day, to actually sign this bill, which had done its due diligence by passing through the House and the Senate, the governor, Hickenlooper, then vetoed the bill in the last day, in the last few minutes. At 5:01, he had asked the families and I to leave the Capitol because we had actually come in with news cameras and we wanted to speak with him, and we were trying to use media pressure to get him to vote yes. He brought the families in behind closed doors, and he told them he was there for them and all of this. But then at 5:01, security asked us to leave the state capitol, and then he vetoed the bill. He said no. Apparently, it was up to Hickenlooper whether or not these moms and parents needed to have medical cannabis as an option. So I was definitely distraught and infuriated, and I was like, this is it. Now this is another log of why this chapter needs to exist. We need to have a bigger medical cannabis voice right now in Colorado. We had just got our plant rights and our grow rights kind of chipped away at us, and they took away our exceeded plant count levels. And that was devastating to the community. Yet again, when you have 5 little organizations talking about this, not with a concise message, we really didn't get it done then. And so I was pumped more than ever to go back and to start Safe Access Colorado. I reached out to my group of advocates who already had been there to help, with Jack's Law and different organizations to get medical cannabis in schools. And there was a solid group of 5 of us always at the Capitol. And so what we did is I told them, I said, hey, we're starting a chapter. And after that moment, I remember even at that day at the Capitol, they were like, we need to do it. And so with these amazing moms and people who had been fighting this fight before me, we decided we were going to start Safe Access Colorado, and it's been amazing so far. I'm very honored that a year later, I've come back to the Unity Conference, again on a scholarship, thank you sponsors, and received Chapter of the Year of 2019. We still have a lot of work to do. By no means is this I feel like there's more I need to be doing, but we are definitely making an impact at the Capitol. Even before session started this year, we have been at the child welfare meetings. We've been able to kill a bill, which was this DUID bill, which was not going to be good for patients. It would have given more discretion to police officers. We have introduced Autism Again as a bill, and then a Senate bill right now, which is what we're working on, is a bill that would add prescription of opiates to the list of qualifying conditions. Ideally, I am taking ASA's lead in this, and that, I believe that, in a year from now, we could see this list of qualifying mandatory conditions kind of, be opened up to whatever the doctor and the patient see fit. If the doctor wants to recommend cannabis and sees that it is necessary, he or she can do so. So that is definitely a goal. But my most proudest moment of being part of Americans for Safe Access and, having their support in, these two bills. So right away in the beginning of session, we had reached out to David and Debbie and asked them for any guidance that we have these two bills. Can you provide us with anything? We're definitely lacking, again, just the medical professionals to come forward. We needed more science and data. So what did they do? They sent me like a 17-page letter for autism, included facts of how the Minnesota Department of Health added autism, and it came from the Department of Health, not through what we've done in Colorado, is we're going to introduce a bill and bring it through the House or the Senate. So a different approach, but very instrumental. And same thing with the prescription of opioids. They were able to provide us as a letter. I read it when I'm at the Capitol. I pass it to every single state representative there, or senator. And I also, back to that most powerful moment of being a member of Americans for Safe Access and also founding, Safe Access Colorado, is we had Representative Edie Hooten out of Boulder, Colorado, who is the bill sponsor for the prescription of opioids bill. To have them read the ASA letter as part of their introduction to that, Senate committee or that House committee, and to say that Americans for Safe Access says that this is them, they're stating facts, they're stating research. And so much what was also very powerful is that in public testimony, I have members of Safe Access Colorado going up to testify. And when they ask you to state who you are and who you represent, they say Safe Access Colorado, a chapter of Americans for Safe Access. And that to me is amazing, just to see that, seeing it now as it's trickling down to our, up the chain of command. And now we have state representatives actually knowing who we are and using the resources that are provided from such an incredible organization. So that is, what, it's brought so much passion to the work that I'm doing. I'm already, promoting education and advocacy and social responsibility. But now I get to also carry ASA's message and build this amazing chapter. People have said to me, even at like MJ BizCon and all these other industry conferences, oh, I'm a patient advocate and I'm in Colorado. People are like, why do they need you? Well, because one, people are still getting arrested. Patients' rights are still being threatened. There is conditions that people still don't have access to medical cannabis in Colorado. And two, my big thing is we need to uplift the medical cannabis patient community, to include medical professionals, to include great programming and education and a support system to have safe conversations. I find that that is a big goal right now of mine, is to really bring the community together and also be a resource to anyone that's looking to take this medical cannabis journey. So very exciting times for us in Colorado to now actually have a presence of ASA there. I'm really excited to be co-leading the charge with a group of amazing advocates who've been doing it. We've got a couple moms that have put bills into place, as long as a professional lobbyist, a researcher, a pro bono lawyer that I've been able to bring together on this amazing team. And we're still calling for people. So, some advice that I have for people looking to get into the industry, to, if you're a patient and you want to feel more empowered and exercise your voice, your legislators do want to hear from you. And if you're in a state that, you feel all alone and maybe there's no better time than now to reach out to Americans for Safe Access and find out who that representative is in whatever city and county and state that you're in. And if you don't have that, you can build one. You can build a chapter just like I did, and you would have tremendous support here from a lot of, caring individuals and professionals and advocates for medical cannabis. So thanks again. That's my video and that's my spiel. Americans for Safe Access, thank you so much. You have changed my life and you've given purpose to so many other people that I bring onto the team or that we're helping, in our state and beyond. So thank you.